Bismillahirrahmanirrahim. Hello friends. Today we will discuss about the classification of gingival and periodontal disease and condition affecting the periodontiums. First of all, we will discuss why we need classifications. We need classification for the purpose of diagnosis, prognosis, and treatment planning. To understand the etiology, pathology of the disease of the periodontium, enhance the ability to distinguish periodontal disease even more clear, for logical, systemic separation and organization of knowledge about disease, help to communicate among clinicians, researchers, educators, students, and epidemiologists and public health workers. Classification of the disease. Gingival disease. Gingival disease, we classify gingival disease into two main categories: plaque-induced gingival disease, non-plaque induced gingival lesions. Chronic periodontitis, we have localized or generalized chronic periodontitis. We will discuss further one by one in the detail, and we classify aggressive periodontitis, localized and generalized, on the basis of their separations. Periodontitis is a manifestation of the systematic disease. Like if there is diabetes mellitus, so in that cases of diabetes mellitus, there is a periodontitis. So categories as a periodontitis is a manifestation of a systemic disease. Necrotizing periodontal disease, we have NUC, necrotizing ulcerative gingivitis, necrotizing ulcerative periodontitis. Abscess of the periodontiums, we have gingival abscess, periodontal abscess, we have periodontal abscess, pericoronal abscess, and periodontal abscess. Periodontal periodontitis associated with the endodontic lesions, endodontic periodontic lesions, combined lesions, periodontal endodontic lesions, as we will discuss one by one in the details. Developmental or acquired deformities and condition, localized tooth related factors that predispose to plaque induced gingival disease or periodontitis. Mucogingival deformities and conditions around teeth, mucogingival deformities and condition in edentulous ridges, occlusal trauma. Gingival disease. We have plaque-induced gingival disease and we have non-plaque-induced gingival disease. Plaque-induced, as name suggested, that gingival disease which are influenced by the plaque. What's plaque? Plaque is a hard materials, is a yellowish materials on the tooth. Dental plaque induced gingival disease. They may occur on a periodontium with no attachment loss or on a periodontium with no attachment loss, and there is a stable or not progressing. Gingivitis associated with dental plaque only, with local contributing factor, result as an interaction between microorganisms found in a dental plaque, biofilm, and the tissues and the inflammatory cells of the host. Without local contributing factors, development and acquired deformities and conditions, these factors may contributory because of their ability to remain plaque, to ability to retain plaque. Microorganism inhibit their removal by patient initiated plaque control technique. Gingival disease modified by the systematic factors we have associated with endocrine systems, puberty, associated gingivitis, as we know that in puberty our hormones may become imbalanced. So due to this imbalance in the hormone, so there is gingivitis. menstrual cycle associated gingivitis, and pregnancy associated gingival diseases. These changes are more apparent in pregnancy when the prevalence and the severity of gingival inflammation may increase even in the presence of low level of plaque. A. Gingivitis. B. Pyogenic granuloma associated with blood dyscrasis. Number 1. Leukemia associated gingivitis may alter immune function by altering the normal balance of immunologically competent WBC supplying the periodontium. Gingival disease modified by medications. Drug-infused gingival enlargement increase use of anticonvulsant drugs like phenytoin. As we have already know that phenytoin is a drug which is used as an anticonvulsant, and the most common adverse effect of phenytoin is gingival enlargement. Drug influenced gingivitis, oral contraceptive associated gingivitis. Gingival disease modified by malnutrition, as there in areas there is malnutrition child, so gingival disease is modified by malnutrition. Ascorbic acid deficiency gingivitis, nutritional deficiency known to be affect immune function, clinically appear as a bright red swollen and bleeding gingiva associated with severe vitamin C deficiency or scurvy. What what vitamin C role in the gingiva? If their deficiency is uh, if the deficiency of vitamin C is occurs, so there is gingivitis, because vitamin C help in the hydroxylations of the amino acids which are used in the collagens of the gingiva. So if the vitamin C deficiency occur, so the hydroxylations of the vitamin C is not taking place. Thank you very much, and we will cover the next portion of the classification of periodontal and gingival disease in the next video. Thank you very much.